Well, children younger than 17 years can get arthritis just like adults. Now, this is known as juvenile arthritis. The disease can be caused by inflammation of the joints, which results in pain, swelling, stiffness, and even loss of motion. Juvenile arthritis is an autoimmune disease. That means your body's immune system mistakes your own cells for an infection and attacks your body. Around 1 in every 1,000 children has some form of juvenile arthritis. Well, joining us in studio is pediatric rheumatologist Dr. Bhadrish Mistry. A very good morning to you, doctor. Thank you so much for joining us.
Thank you for having me here.
Now, can you just explain to our viewers, in possibly more layman's terms, what exactly juvenile arthritis is?
Okay, so arthritis is, it comes from the Greek word arthro, which means joint, and itis means inflammation. And it's inflammation within the joint itself. Now, the joint has a lining, it's called the synovium, and it's inflammation of that part of the joint that causes all the trouble in arthritis. With juvenile arthritis, the arthritis is characteristic in children under the age of 16, and it's present for more than 6 weeks. Yeah.
All right, and I mean, this arthritis can it attack any of the joints in the body, or is it normally just the hands?
So juvenile arthritis, there are about 6 subtypes. It affects different areas, different joints. The one particular subtype affects different organs in the body. So it presents with fever, you may have a rash, you may have liver enlargement, spleen enlargement, you can have the lining of the heart muscle inflamed as well. So it's not only joints, but it also affects various other parts of the body.
All right. And you mentioned a fever and, liver inflammation. Yes. What are the outward symptoms that a person could probably identify in a child to tell if they have possibly arthritis?
So with arthritis, the earliest features are joint pain and swelling. The swelling usually affects any of the joints. The other features are inability to move a joint as a result of the swelling and the pain. Other features that are characteristic of juvenile arthritis is morning stiffness. Now, the stiffness is usually present, can be present there for a few minutes, and then as the day progresses, the stiffness wanes. Other features that can present also, and if that's arthritis that's not treated, is deformities.
All right, and is arthritis curable? What sort of treatments does a person go on once they've been diagnosed with juvenile arthritis?
So in this day and age, the treatment of arthritis is a multifaceted approach. So it involves drugs or medication, involves physical therapy, it also involves counseling and proper nutrition.
All right. And what could make a person possibly susceptible to getting arthritis? Is it something that you can do to prevent yourself from getting it, or that makes you more prone to obtaining it? Is it genetic? What determines how a person catches it?
There's no known cause for the arthritis, but certain individuals that have, there is a genetic susceptibility, and when you're exposed to either an infection or an unknown trigger, they do present with arthritis.
And for the sake of our viewers, some people have myths about diseases. So, yes. Is arthritis contagious?
No, arthritis is definitely not contagious. It's a disease process that comes along at any point in your life, even in young children from about 2 to 3 years old, 2 to 3 years of age, yes.
And with the patients that you've had contact with, do they respond positively to the medication, the treatment package that you mentioned, the drugs, the nutrition, the physiotherapies? Is there like a positive solution when you're on the treatment?
There is. And the good thing is that the children respond to treatment provided that the arthritis is diagnosed early. This is the most important thing. The diagnosis needs to be early. They need to have proper treatment, and they have a favorable outcome. In this day and age, there's fantastic, phenomenal therapies. In days gone by, we used to use anti-inflammatories, which are still part of the treatment, but there are now therapies that are focused very specifically at certain areas of the inflammatory pathway, and these agents are called biologics, and we've had fantastic responses with these agents.
And what about exercising? Does that, I mean, if someone does extensive exercising or intense exercising, are they sort of making their joints more prone to it?
No, not really. So if you do have arthritis, you want to get the inflammation under control.
Okay.
So with your treatment, with your medication, and once the inflammation is settled, then you progress onto exercise therapy like physiotherapy or hydrotherapy, and if you don't settle the inflammatory response and you do exercise, you actually aggravate the whole process.
Okay, so exercise once you've reduced inflammation is a good thing, but exercise whilst there's still inflammation actually makes the problem worse.
It's a vicious cycle, yeah.
All right.
Yeah.
And what I was actually just thinking about something, a thought just actually crossed my mind earlier on. Picking it up early enough, are there any screen tests? You mentioned that if you can diagnose it early enough, it actually helps you cure it on time. Are there screening processes that children go through? At what ages should you start screening for arthritis?
Okay, so this is the difficulty of juvenile arthritis, is that there's no blood test or investigation that's going to diagnose arthritis, and it's all based on a thorough history and examination. Excluding all other causes of arthritis before you come to juvenile arthritis. And with regard to screening, I mean, if the presentation is usually a child that comes in with joint pain and swelling that's persisting, and you know, it's early referral and not leaving a child to continue with those symptoms.
So one can't even check their genes to see if perhaps there is that risk of getting it?
No, they are. So you can have, I mean, so if you can check the gene, but it doesn't mean that you will develop arthritis, even though you have the gene. So that's the tricky bit.
Thing about
that's
it.
the tricky bit.
So what websites can people go to if they want to get more information and more knowledge about arthritis? You know, how to handle it, how to pick it up early.
So they can go into Arthritis Kids SA. There's also there's various international websites. If you just Google kids in arthritis, so the American College of Rheumatology, Printo, Printo. There's lots of useful information there, and yeah. So if you just Google kids with arthritis, yeah.
And just for the sake of parents, if a child's been treated for arthritis, they can still go to school, right, normally, considering that they just take their medication on time, right?
Yes.
It wouldn't interfere with that.
So kids, once the arthritis is under control, they can lead normal, healthy lives.
All right. Well, thank you so much for the insight, Doc, and thank you so much for your time. That was pediatric rheumatologist Dr. Mistry. They're just giving us some insight into juvenile arthritis, you know, how to spot it, and that good treatment and early treatment actually can help your child live a healthy life.